What is prediabetes? Well, prediabetes is a condition referring to a high blood sugar. So in our body we have a sugar called glucose, and this glucose should sit at a steady level most of the time. And if we eat something that raises our blood sugar, the body should bring it back down again. Now in prediabetes, the body is struggling to maintain this normal blood sugar level. It hasn't completely lost control, and it hasn't turned into type 2 diabetes yet, but it is struggling. And this means that if we eat anything that raises our blood sugar, the body's going to struggle to bring it down. And it also means, even when we're resting and we haven't just eaten, the body, or specifically the liver, which sits at the top right of our tummy, will be making too much sugar, which is raising our blood sugar level. Now, prediabetes is usually now diagnosed using a test called HbA1c, and HbA1c is a blood test that gives you an average of your blood sugar over an approximately 3-month period. And an HbA1c level of 42 to 47 indicates prediabetes. Below 42, so 41 or less, is considered normal, and 48 or more is considered type 2 diabetes. So in summary so far, prediabetes is a condition of raised average blood sugar that isn't yet high enough to be diagnosed as type 2 diabetes. And the reason this is happening is the body's lost control of being able to respond to foods. When we eat foods that raise our blood sugar, the body's lost some control of bringing that down rapidly. And also, even if we haven't just eaten, the body, and specifically the liver, is making too much sugar. Now, why does this happen? Well, there is a number of factors that lead into why prediabetes develops, but most importantly, it is our lifestyle. So we have our lifestyle, such as nutrition, how we move and the amount of movement we do, sleep and the amount of sort of stress or chronic stress in our life. Those are some of the major factors that can influence whether or not we develop prediabetes. These, of course, also sit alongside other things that we have less control over, such as our genetics. So prediabetes shouldn't be seen as something that we are all destined to get. Some of us may have an increased family or genetic risk, but actually the level of prediabetes now is vastly more than it was just a few decades ago. So this tells us that it actually is our lifestyle that's important. So in summary, prediabetes is a condition of raised blood sugar, but not yet high enough to be type 2 diabetes. It is mainly driven by our lifestyles, and with that, it is our lifestyle that can, to some degree, fix the problem.